Hi, I'm Dr. June Chin, and I'm an integrative cannabis physician. I was a cannabis patient before I even became a doctor. As a teenager, I was diagnosed with ankylosing spondylitis, a progressive type of arthritis that affects the spine and the pelvis and causes extreme nerve pain. I spent my younger years trying epidurals, muscle relaxants, physical therapy, but the pain was unrelenting. By the time I got to med school in San Francisco, I was having difficulty standing for long periods of time in the operating room. Here I was in a hospital surrounded by great medical minds, but I was disheartened because I couldn't find anything to help my condition. One of my attending physicians, an HIV and AIDS doctor, pulled me aside and handed me a bottle containing tincture medicine. "This is marijuana," he told me, "but it won't make you high." He didn't call it CBD oil. He just said it was a different type of cannabis plant. Cannabis changed the trajectory of my life. I would not have been able to finish med school and become a physician if it had not been for cannabis treatment for my chronic pain. I've been helping patients integrate medical cannabis into their health and wellness for almost 20 years. I have owned and operated 6 integrative clinics in California, New York, and Connecticut, leading a team of MDs, naturopaths, therapists, treating both pediatrics and adults. Besides my clinical practice, some of my projects include clinical studies, advancement of doctor education, community health equity, and digital therapeutics to support cannabinoid medicine. Now, in my medical practice, we collect every piece of information and integrative cannabis use in our patient records. The richness of our data, not to mention the sheer volume, is a bottomless well of therapeutic data. Which type of cannabis formulations do patients prefer? How often are they purchasing it? Our cannabis patients monitor their real-time health. Why do certain cannabis products work for men and not women? I'm looking at cannabis usage adjusted to age, gender, weight, physical activity, genetic tests, blood tests, and even diet. Our clinics create customized treatment protocols integrating cannabinoid therapeutics. So through these data insights, we clock that patients were very interested in certain brands, but we're also clocking which brands that were not producing products that match up with patients' needs. We're getting data from our patients over 100 times a year. And all of that data that we receive, we're able to port back both into advising them on what to buy or help manufacturers make better products. We understand a huge amount about our patients because our patients are telling us not only about their cannabis usage and preferences, but they're also telling us about their lives. So we understand a whole lot about the users and we're able to match these data sets together. And now that I have this data, who else might find it useful? I take these insights to different companies, not only suppliers and dispensaries of the cannabis industry, but to medical centers, companies that specialize in pharma, nutraceuticals, research, even lifestyle cannabis brands. Cannabis is empowering medicine. The cannabis plant is unique. There's no other precedent, no other drug in the world that we're using both recreationally and medicinally. Patients are looking for reliable information, but have very few trusted healthcare provided resources. And as healthcare practitioners, it's really our responsibility to be capable of engaging in meaningful discussions with our patients regarding the potential harms and the potential benefits of cannabis. Thank you.